Hi, this is Dr. Rakesh Jain. I am a pediatric neurologist in Fortis Hospital, Gurgaon. I have been working here for last nearly 12 years. Before that, I worked in the UK and I was consultant in Oxford. My total experience in the UK was about 10 years and 12 years here in India. So today I will talk about epilepsy in children. So we'll talk about what is epilepsy, what are the different types of epilepsies, how to diagnose, how to approach a child with epilepsy, and how to manage. I will try to be as brief as possible, but in some of the topics I may have to go in little details. So if you don't understand anything, you can just put in comments and at some point I will try to answer those questions. So first of all, epilepsy. Epilepsy is basically, it's a recurrent seizures. And then what are seizures? Seizures is any cessation of activities. Like if I'm sitting normal, if I start having jerking of my hand, if I start having a rolling of eyeballs, if I don't have any control on my voice, if I suddenly freeze and I don't become responsive. So there could be any type of seizures. There are multiple types and all of them, they have different names. So we can talk about it. So in general, there are one we call it generalized tonic-clonic seizures, where whole body gets stiff, then it starts shaking with eyes uprolling, sometimes frothing through mouth, sometimes twitching of eyes, and in generalized tonic-clonic seizure, children usually lose the consciousness. They become unconscious. And even after stopping the seizure, the child can become drowsy and he or she can take long time to get back to normal. So this is a classical generalized tonic-clonic seizure. Then in generalized variety, we have more seizures, like one is absence epilepsy. It is fairly common. What is absence epilepsy? Where a child usually, talking and then it suddenly freezes. As if for the 5-10 seconds, child has become statue. Or sometimes there could be some chewing movement like that. And it happens multiple times a day. It can start anytime, like at 5 years, 4 years of age, and it can really hamper the scholastic performance. Generally, we come to know about that sort of epilepsy when the school performance starts getting down. So that needs to be kept in mind. That can be diagnosed easily and treated. Then we have infantile spasm. This is also a form of generalized epilepsy where children less than 1 year of age, they suddenly get spasm like that, as if, they are getting electrical shock. And along with that, sometimes the child could cry and it comes in clusters. Generally, when the child wakes up, he gets more of these spasms. If we don't catch them in time, if we don't treat them appropriately, so in a fortnight or a month or of these seizures, the child would start losing some milestones. We call it regression of milestones, and that is not a good condition. That is difficult to control. If we lose time, we lose months, then it becomes really difficult to treat, not only with the medication, but with other measures as well. There are other forms of generalized epilepsies. I will not talk about all the details. These are the common things I would want you to know, to be aware about them so that you don't miss it, you don't get delayed diagnosis, and you don't want the poor outcome. Then we have certain focal epilepsies. As the name suggests, focal means when the electrical disturbances or electrical sparking is happening in a particular part of the brain. In those cases, what happens? You may have jerking of one arm like that. It could be of, just vibration, heavy jerking, or just stiffening of one arm, and rest of the body is fine. Or it may be associated with sometimes twitching of one side of mouth, fluttering of one eyelid, or excessive blinking of one eye. So anything which is not symmetrical, because our body have two parts, two hands, two legs. So if it is a one side of the body which is moving, then it is called focal seizures. And the focal seizures are somehow more dangerous and less prognostic, in terms of the outcome. So we cannot afford to miss a focal seizure. If it is there, we need to get in touch with our physician and get it diagnosed properly. So these are very basic types of seizures. Now, what do we do if we get a child with seizure? Or in other words, how to approach a child with seizure or epilepsy? So first of all, when the child comes to me with the complaints that there are suspected seizures, I take detailed history and I make sure that this is clear-cut seizures, because sometimes the abnormal movements, it could be non-epileptic as well. So a good clinician first of all would make sure that the seizures or epilepsy I am dealing with is epilepsy. It's not non-epileptic. Okay. There are different things, I'm not going to talk about that, which are non-epileptic movement, but they can mimic epilepsy and they can mislead you in the diagnosis and the treatment. So now we are focusing on seizure and we are assuming the child who has come to me has epilepsy. So I'll take detailed history, then I will clinically make my judgment. I will try to see the video. So nowadays, everybody in the household has smartphones or video cameras with their phone. So please make sure if the child has it, please try to make a small video clip, whatever possible, keeping the child safe while the child is having it. So having seen the video, having examined the child, I would see whether this is generalized epilepsy, focal epilepsy. And if the child is still having any seizure, I would obviously address that problem immediately before I order any investigations. So what investigation we should do? Generally some blood test. We need to make sure that sugar levels are fine, calcium is fine, the salt level in the body is not bad, the basic blood test. Then we would want to do an imaging, CT scan or MRI scan, although MRI is always preferred in cases of epilepsy, that to see if there is any structural problem inside the brain. And what could be the structural problems? It could be any problem in the malformation since birth. There could be some genetic issues. There could be some swelling inside the brain. We call them tumors. There could be some inflammation like infection or sometimes worms inside the brain that could lead on to these problems. And many a times the MRI could be normal as well despite of child having epilepsy. So what else we can do? So MRI we have done. Then we do a encephalogram, or we call it brain wave test. So we put an electrodes on the brain. Some of you might have seen that. It's a non-invasive test. It doesn't involve any pins and needles. So you just have to put the electrodes on all over the head, and the main wire is connected to the computer, and it would tell how the brain waves are doing while the child is sleeping, while the child is awake, while the child is breathing faster. So we make different things do to get the appropriate reading in our computer. So we do the proper reading and we come to the conclusion that this is epilepsy, this is this type of epilepsy, and this is the prognosis, and these are the kind of medicine would be most suitable for a particular type of epilepsy. So up till now we have discussed few types of epilepsies, what we have to do if the child comes. These are the tests that we have to do. And then before I jump on to the management, there are some basic housekeeping things in the children with epilepsy. So if your child has epilepsy, you must make sure that you must ask the doctor what to do if the child has seizure in house when you are alone, or when you are with the child in the supermarket. What do you do? So if the child has seizure, the best thing to remember is, if you do less, it would be better for the child. Don't put anything inside the mouth. Don't offer him a glass of water. Don't jolt him, in case he's not responsive. All these things can do more harm than the good. So what you should do? So if you find that child is having seizures, the best thing is find a safe place and make the child lay down on the floor. and with a slightly left lateral position, we call it recovery position, and try to support the head with some sort of pillow or any object that could align the head, with the shoulder, so that the head doesn't fall back. And generally, seizure stops within 5 minutes. So you keep the child in that position and let the seizure settle down. If it is first time, you wouldn't have any medicine with you, nothing else, so you don't have any choice. You keep the child in that position and try to raise the alarm or try to seek help from surrounding areas. And if your child already had epilepsy, then the physician must have given you a nasal spray. So in that case, you could use that spray, the dose being prescribed by the physician, and that will help in aborting the seizure. So this is an emergency measure, you should always remember. And now comes, what are the treatment options? There are a lot of options available, and if we diagnose the epilepsy patient correctly, the prognosis is good. I would say 70-80% of the children with epilepsy, if treated appropriately, they get almost free of seizures without any long-term comorbid problems. So in other words, they get almost cured, I would say. Wouldn't have any problem, they can become seizure free. So how long is the treatment? Generally, the rule of thumb is it's a 2-year seizure free period. Let's say if you have a seizure today and we have diagnosed it as an epilepsy and we have started the treatment. And after starting the treatment, let's say the child has been absolutely fine, then we will give the treatment for 2 years and then we will gradually taper it off. So I hope this video is useful. So that's what we manage epilepsy. Prognosis is generally good, provided we don't lose time in making the diagnosis and we don't let seizures to flourish and end up in intractable epilepsies. That is approximately, I would say, approximately 20% of the kids, even less than that, would have intractable epilepsy, where, even multiple medicines, they don't do very well and the children continue to have epilepsies. So my last message is, be aware about epilepsy in kids. It is fairly common means, approximately, 1 child out of 100 would have epilepsy, whether in fever or without fever. So just be aware. If it is there, let's get to the right person, get the correct diagnosis and the correct treatment. Thank you very much. All the best.